this exercise is gonna take our hip flexion lift-offs and make them a little more challenging. So typically for a hip flexion lift-off, we are going to want the box to be higher and closer to our end range so we can only clear it like a little fraction of an inch. For this, we're gonna make it a little bit easier because you're probably gonna lose some range of motion. So you wanna be able to clear the thing that your foot is on by several inches. Then from here, you're gonna lock the leg that's on the ground and kind of push it into the ground more. So it's gonna help you stay really tall in this movement and feel like your glute and quad and everything are nice and tight. Then from there, without hiking your pelvis or leaning back, we are going to lift your knee as high as you can in the front. We are also not bending the knee. Then from there, we are going to hinge at the knee without losing height. So we're gonna do our reps here, and a lot of people when they start to do this, they will kind of do this movement, which is going to make it a little bit easier. So instead of that, we wanna keep that knee high and just do the movement that we can at the knee where we can maintain the height, then we're gonna parachute it back down. Now, as a lot of people do this at first, they will typically get some quad cramping. So we want to proceed with caution if this is new for you. And the other thing is as we fatigue, we'll start to compensate with the leaning of the back, the bending of the knee, and just kind of losing the position that we started, or the hiking. We want to make sure you're trying not to do that. And as soon as you feel like you start to do that more and you can't control it, you've reached the end point of fatigue for your leg. So that just means the exercise is done. Over time, you should be able to progress with more reps of the hinge, or we should be able to get the knee higher, or we should feel like we can keep it higher for longer. And those are gonna be signs that you are making progress. Honestly, for most people, the first sign of progress is just a little bit less cramping. So you wanna flirt with the edge of cramping. We just don't wanna push into that to a full-blown muscle spasm. Start light, you can always progress later, and over time you should notice those little glimmers that your body is making the adaptations you're asking of it.